ask what they can do when they experience thinning hair, when they see their hair thinning or falling out. Before you actually need a hair transplant, there's a few things that we can do to help you prevent from further hair loss and also to help you regrow your existing follicles stronger and faster. Aside from the various medications that I've spoken about in the past, such as finasteride, minoxidil 5%, a solution that I really love is PRP treatments. Those PRP treatments is basically extracting the patient's. So through a special centrifuge and through special tubing technology, we basically separate the platelet rich plasma from the red and white blood cells. That has regenerative cell properties. There's two ways we like to do it at Beverly Hair Group. The first method is with Acell, which is a micromatrix. It's an animal derivative that has regenerative cell properties as well. Think stem cells. That helps increasing the potency of PRP itself, making it more effective. And the second method that we believe is more potent based on the cell content is with micronized fat. We do a little bit of lipo in the abdomen of the patient. We take that fat and we're going to liquefy it, basically micronize it and mix it with the PRP. So with either method, we're going to come in the scalp and do approximately 2,000 injections in order to target all your existing follicles. The idea behind PRP is that it stimulates the follicles into regrowing stronger and faster. Now, everybody benefits from PRP in the sense that patients don't experience any further hair loss or their hair loss slows down considerably. 50% of the patients get lucky and actually experience regrowth and stronger follicles.